So, my name's Nick. I'm from Perth. I'm here in London. For anyone that's from Perth, those are the blueprints of the Hotel Albion, my favourite pub from Perth, just down the road from where I grew up. I'm here, and you guys have a really exciting day ahead of you. So I am going to be as brief as I possibly can as we kick this off. I'm going to talk about three things: why, what, and how. Why the NHS might care about this, what on earth the NHS thinks it is going to do about it, and most importantly, where we need to spend all of our effort and time thinking and working, how, what tomorrow morning are we all going to get up and do about this? So the NHS, we're very proud over here, you can imagine. World's first health system with universal health coverage, founded with a pretty exciting principle: high quality care for all, now and for future generations. 80, 90 years, that's what the NHS has been about. It's on every bit of letterhead we send out to every single patient: high quality care for all, now and for future generations. So to answer the question of why would the NHS care about climate change? It's very, very simple. You cannot achieve that goal unless you respond to climate change. You can't do it. Here in the United Kingdom, in fact, globally already today, I checked this morning, I do it every now and then when I want to depress myself, global average surface temperature, 1.17 degrees above pre-industrial average. Temperatures rising at a pretty significant scale. How much energy into the system? Well, very, very roughly the equivalent of 6 atomic bombs worth of additional energy released into the planetary system, into the atmosphere, every single second of every single day, of every single month, of every single year for decades and decades, resulting in that 1.17 degrees rise. For the NHS, we expect within the next 9 years, resulting in the doubling of the number of our facilities across the country that are in high-risk flood zones, resulting in a tripling of the standard deviation of the heat waves that we have to deal with, that our patients have to deal with, that our staff have to deal with, that our facilities, and listen, here up in the United Kingdom, we're not equipped for that kind of heat that they have to deal with. For the first time a year and a half ago, 18 months ago, Public Health England found an endemic Aedes aegypti case. Wasn't carrying anything dangerous, but it was the first time in 50 years we found that up here. And we know from past experience, not Aedes obviously, but malaria previously found throughout Germany, and we know many of the slightly more dangerous things that Aedes can carry, previously found and currently marching up through Europe. The NHS can't exist, can't continue to do the work that we do, high quality care for all, now and for future generations, unless you respond to climate change. That's the first reason why. The second reason why is because, hey, we're part of the damn problem. We are big, 1.4 million health professionals scattered across the country, the 5th largest company, the 5th largest organization in the world, responsible for 5%, just under 5% of national emissions. The total emissions of the NHS, roughly the same size as the entire country of Denmark, the entire country of Croatia. We are 40% of public sector electricity consumption. We are 36% of public sector emissions. We're a part of this problem, and all 1.4 million of those health professionals signed, spoke, pledged some kind of oath when they started: first, do no harm, primum non nocere. It's the second reason why the NHS cares about this, because we know that we're part of the problem, and so we need to be part of the solution. The third reason why the NHS cares, and this is the really important one, right? Number one is impact. That's scary. Number two, part of the problem, we want to do something about it. Number three, though, this energizes our staff. Every single year we go out and we ask NHS employees, 1.4 million of us, hey, what do you care about? What do you want to see the NHS do more of? What really gets you up in the morning? Every single year, staff shout back at us. They demand, we want to see, we want to drive forward the NHS's response to climate change. Now, I was quite worried that in 2021 we could be forgiven if there were other things on the mind. It's been a busy year. There's been a lot going on. I was anxious about asking that question again because it might give you an inconvenient answer. I was wrong to be anxious. 2 percentage points higher. 92% of staff shouted back, even in 2021, I want to see the NHS respond to climate change. I want to work for an organisation that is aligned to my personal values. That's the why. That's my version of the why. If you are here already in the morning on Tuesday, sometime in December, November still for you guys and for me, you don't need to know the why, but that's our version of the why. Planetary scale crisis. So what are you going to do in response to that? The NHS has cared about this issue for a long time, 10 years. We're proud of our track record. The NHS is proud of its track record. Just last year, 2020, there was a step up, not just of 1 or 2 gears, but an order of magnitude in the response to climate change. We went from what was previously a small team, 4 or 5 people, working on starting to envisage, starting to sketch out what a solution might look like, to a team now, to an army, a small army of 140 health professionals dedicated to greening, to transitioning the NHS to a net zero healthcare system. And that's the important part of the what. For the emissions we control directly, net zero by 2040. For the entire footprint, not just within the United Kingdom, not just within the 4 walls of our health system, but our entire global supply chain footprint, 2045. We're taking responsibility for that, despite the fact that we know that that's going to be particularly tough. And that's where the real magic of a target like that is in that full footprint. And if someone isn't making commitments like that, then I promise you they are ducking the hard questions. 2040 and 2045 are a long way away. And so you need something closer that is going to make people feel uncomfortable. 2028, we want to see an 80% emissions reduction target. We're going to have a really steep decline, and then we're going to bottom off because we have a last mile problem. The last 10%, 20% or so is really tricky just because of some of the nuances in how healthcare runs, because of some of the physical infrastructure we own. That's the why. That's the what. Where I said and where I think we should spend our time thinking about. We don't need to talk about why. We don't need to talk about whether or not we should be responding like this anymore. The time for that was decades ago. The only real discussion now should be tomorrow morning, how? What are you going to go and do about it? Not what are you going to go and do in 2040, not 2028, but tomorrow morning, what can you wake up, do to reduce your emissions? And so we report annually now. We report publicly and annually because we want to hold our own feet to the fire on our emissions reduction. 12 months ago, when the NHS became the world's first health system to make that commitment, we said, hey, our annual emissions reduction that we need to achieve, 1,260 kilotons of carbon. 1,260 kilotons equivalent of carbon. Roughly, to put it in context, it's a bit meaningless without that, 1.7 million flights from London to New York, 1.1 million homes powered throughout the year up in cold Yorkshire, where God, you need some heat. That's what we were aiming for. So we've had 12 months. What have we done? Let's break the emissions profile of the NHS down and talk through each piece. So the estate is a big part of our emissions profile. Depending on how you cut it up, somewhere between 12 and 20%. Couple of things. Number one, we've invested. We've invested heavily, £310 million in year one. £500 million in year two, coming up just around the corner. We've invested heavily in climate smart healthcare, in more efficient healthcare, in digital first healthcare, trying to make sure that the care that the NHS is providing is world class, trying to make sure that it's more comfortable for our patients. The real secret of a lot of this, though, is it pays back so quickly. The investment in a net zero capital estate, it pays back in 3 3.5 years. It's got some of the best ROI you can imagine. And the reason we have ROI like that is because, God, we're just talking about efficiency. We're just talking about doing excellent healthcare just a little better. So we've invested in that, and we're already starting to see the benefits. It's looked like anything from transitioning and decarbonizing the way that we heat our buildings, solar panels on roofs. It's looked like electric chargers scattered across the system, electric vehicles. It's been a really exciting 12 months for the estate. That's the existing estate, though. We also have a commitment to build 40 new hospitals. The number varies a little depending on how you count the hospital, but 40 new hospitals. Each of those things, I promise you, they've got to be net zero if you want to get there by 2040, 2045. And so we have a new hospital standard. It's not ready right now, but we have one of our, I'm hoping, final meetings with the minister in a couple of days to finalize this. A new standard for all hospitals, all new hospitals built in this country, meeting that net zero standard. Now, if someone tells you, hey, I can build a net zero hospital today, they're lying to you. Technology isn't quite there. They're probably offsetting far more than we should allow. So what this standard does is it takes the best available. It takes the long-term cost profile and allows us to reinvest some of that savings accrued up early and up front. And then it has a process for continuously improving. There's a process for, thanks, Carol. There's a process for shifting as technology increases over time. I reckon about 4 years from now, we will be able to say, hey, we're on our way to building the world's first net zero hospital. That's the estates world. That's the fixed assets. You've got to get patients to and from those assets as well. And so in the transport world, we're looking very seriously at electrifying the fleet. We're not just looking seriously at it, I shouldn't say it that way. We've shifted our contracts. Give us 8 years and we are going to start only contracting with suppliers that are able to provide fully zero emission vehicles. That stuff's going to be easy. Some of the harder stuff is the specialist vehicles, the rapid response vehicles, the ambulances. There again, we're really proud. In the last 12 months, we've put a lot of investment into innovation. Previously, a couple of weeks ago, there were no zero emission ambulances in the world. Now there are 2. One of them fully electric, carrying patients right now in Birmingham. The patients love it. It is quiet, it is more comfortable. The air pollution is less. The other one, an electric hydrogen hybrid. It can go 300 miles on a single refuel. It can cover all of our rural populations. Estates, transport, we have new incentives into medicine, switching away from some of the most polluting anesthetic gases, switching away from some of the most polluting inhalers, switching away from some of the outdated forms of gaseous analgesia, shifting to better quality medicine, but accelerating that transition because we know it's good for our patients. It's also good for our response to climate change. Estates, transport, medicines, procurement. The NHS buys a lot of stuff. 80,000 suppliers, £60 billion worth of spend every single year. We have been very, very clear. Beginning January 1st next year, every single tender will have a 10% weighting for carbon for net zero built in. April 2023, all contracts over £5 million. If you want to do business with the NHS, you have to demonstrate that you are aligned with our principles and aligned with our trajectory on net zero. 1 minute past midnight, April 1st, 2027, every single contract, full stop. If you aren't aligned with the NHS's trajectory towards net zero, we're very sorry, we're not interested in doing business. We want to make sure that we are doing business with companies, with parts of the economy that are aligned with our principles, with our values, and we know that this is the direction to travel. So look, that's the why, that's the how, that's the what, and that's the how. It's been 12 months. The work in the estates, transport medicines, the work of tireless nurses, pharmacists, physiotherapists, setting up new sustainability innovation projects, new ways of interpreting our net zero strategy, down to the trust level. There's not just one strategy anymore. There are 220. Every single trust has a net zero strategy now. That work over the last 12 months is what's got us to the point where we are really proud, cautiously proud, to be able to say that we hit our first year emissions reductions targets. Proud because it's important that we start to move away from talking and we start to move towards doing, that we start to do. Cautiously proud because the next year and the year after that and the year after that is going to get harder. We've hit a lot of low-hanging fruit, so we're going to have to start tackling some really tough stuff. I'm going to finish with the reason that we're cautiously optimistic. 12 months ago, the NHS was the only healthcare system, the only national healthcare system in the world, 1.4 million healthcare professionals, 120 billion pounds worth of turnover. The only one with a net zero target. Just a week or three ago, up in Glasgow, a really special moment happened. Not everyone saw it. The world went from 1 to 14. 14 healthcare systems around the world. Some of them doing impressive stuff back home in Indonesia, in Malawi, and Fiji. Some of them big healthcare systems, Spain, Benelux. And a couple more, I promise you. Watch very closely what Germany has to say over the next 3 weeks. Watch very closely what the United States has to say over the next 2 weeks. A couple more on the way. The reason I'm cautiously optimistic is I know that we have hit some low-hanging fruit and this is going to get harder. But I also know that the NHS is no longer alone. I also know that this is no longer just something that is possible, that is interesting. Oh, that's nice. The NHS has started to think about this. It's no longer something that is just positive and it's sort of, nice to have, despite the fact that, surely we have other priorities within a healthcare system. In the middle of a global pandemic, transitioning to a net zero healthcare system has not just become something that was possible or positive, it has become something that is inevitable. This is the direction of travel for the world's healthcare systems. The question has now changed from what are you doing on climate change to why on earth are you not charging ahead? Why are you not at full speed transitioning? You're going to get left behind. I'll stop there. Thank you very, very, very much for having me. I'm so sorry I couldn't be there in person.